Hello, Dr. Brucker from LV Longevity Lab here in fabulous Las Vegas. The first person that will live to 135 years has already been born. Will it be you? Let me tell you a little bit about one of our featured devices here at our clinic. It is the Emsculpt, and to help me demonstrate the indications and use of this device, I'd like to bring in my first patient, get her on the table, and start the process. Today's indication is going to be for abdominal musculature tightening. So we'll be applying the paddle directly to the skin over the abdomen. The device is painless. It does feel like a little bit of a twitch or a tickle. It is accompanied by heat, which helps our process, so we'll be applying both of those today. Typically, this is one of 6 treatments, depending on age and how much work needs to be done. Each of these treatments is designed to last 30 minutes, and like I said, is painless, but you'll see me moving around a bit to make sure that we got the paddles fitting correctly. And I'll be adjusting the intensity of the contractions as well as applying heat, which helps dissolve some of that deeper fat that surrounds our muscles. And in this particular indication, the paddle also is able to penetrate into the abdomen and help melt away some of that visceral adiposity, or the fat that surrounds our organs, and is in no way beneficial to us. So let me just get this one started. Give me a second. Okay. Of course, I'm not going to ask her at your age.
I'm young.
I'm going to assume you're solidly in your 20s.
Ooh.
So you can feel a little bit, you can probably hear that buzzing going on in the background. And that's just the device activating and warming up the muscles. A little bit later in the treatment course, you'll feel the contractions a little bit more vigorous,
Okay.
a little bit stronger.
It is like a tickle.
Do you feel like it's centered over your abdomen right now?
I do.
Okay. Is it painful to you at all?
No.
Okay.
It's kind of pleasant in a weird way.
Yeah, yeah. So that ticking is actually the device moving the muscles a little bit to stimulate blood flow going to the area, because blood is actually what we're looking for here. It helps not only nourish the muscles that you need, because essentially you're doing a lot of exercise, or will be here pretty quick. You have to have the blood flow to match.
Gotcha.
All right?
So it's like a little ramp up time.
It is exactly that. And intermittently it'll kick in and do it again. It kind of gives you a break.
Oh, okay.
Yeah. And if it starts getting a little uncomfortable, put a wedge up underneath your legs, and that kind of takes the squeeze off of the muscle that you're placing on it by laying flat. So the principle, the reason this works is this device is creating a field that activates the nerves that go directly to your skeletal muscle. And in this way, it's called depolarization. The nerve is sending a signal to the muscle without the inhibitory effect of your brain. So it's not allowing you to hit the wall that you might experience at a gym, for example, lifting weights, where you just physically can't go anymore. That's your brain shutting things down. With these devices, because they're attached directly to the muscle or muscle groups, there's a number of indications for this machine. The device is stimulating the muscle directly, near maximally, and then very rapidly. So you're getting super physiologic thresholds out of what you were able to do on your own.
Oh, that's
well
good.
above it.
I can't do a whole lot on my own. I do okay.
So you're in great shape, but one of the indications here is toning. The device has 3 effects. You can think of it that way. The first one, and really the major effect of these devices, is to bulk up skeletal muscle up to 30%, which is pretty significant. And they've done this and measure the effect of this device on skeletal muscle by looking at MRIs. So you might recall that X-ray look at bones, MRIs look at soft tissue as well as bones. This is your first contraction. I can turn it down a little bit. If
Oh,
you
I don't mind. I definitely want the full effect.
Well, the scale goes to 100%, but we base it on the person.
Okay.
More is not necessarily better, but some people require a little bit extra oomph in the power setting, whereas others, such as yourself, are probably going to get away with probably needing no more than about 30% of what this device can do.
Where is it at now?
It's at 15.
Oh.
Yeah. You might also feel a little heat going into it.
Yeah, it's
That heat stimulates blood flow. That'll bring the nutrients to the muscle, but the heat also, when it's high enough, closer to the 100% mark, you're currently at 30, it creates a temperature in the fat that exceeds the threshold that cell can survive beyond. So what it's doing, it's basically not immediately melting away the fat, but it's creating a situation where the fat is unlikely to survive. And it's being used up as energy, because as you might imagine, 5,000 sit-ups or crunches is a lot. Now, you'll find later today, you won't feel fatigued and you won't feel sore, as if you might feel when you were exercising on your own. So it's painless, and you can include this with your normal workout regimen. It's not either or.
Wow.
So the effects are actually doubled. So we've already talked about how it can increase your skeletal muscle, in this case, your six-pack, by 30%. We also talked about how it can mobilize the fat immediately beneath the skin but above the muscle, which is probably being used as an energy source for the contractions. But it also can penetrate more deeply into that visceral fat layer, which gives people the pot belly. Obviously, not something you have to worry about, but others do, because that fat is not helpful in any way. It can become, in its own way, another endocrine organ, creating hormones that are not necessarily helpful, among other things. An additional risk factor for heart disease. So the device, even though we're using it more for a sculpting purpose, has a lot of health-related benefits. And some of the men that I work with, getting rid of that pot belly is one of the hardest things to do. That pot belly is contributing to a condition called metabolic syndrome. And metabolic syndrome is a risk factor for the development of coronary artery disease. So the blocking of the arteries to the heart, for example. So it's circuitous, and it's a roundabout way of saying that not only do you look great, but this is actually helping your health status overall. Now, this particular paddle is being used for your stomach, but we do have different paddle sizes that we may have an opportunity to show later. For example, to work on a person's bum, their bottoms. The cheeks are basically an outward representation of all the musculature you use to maintain your stability of your hips and your pelvis. So in your particular case, you're in great shape. You don't necessarily need it other than for sculpting and toning, but I do have other patients that are geriatrics that get around with walkers, for example, or a cane, and they have problems with balance and later with coordination because the skeletal muscle that they used to have that would hold the hip steady has faded away with time. So they're ideal candidates for this device as well.
Wow.
We also have other folks that have weak quads. The quads are the muscles you need to help straighten your knee, help you stand and stay standing for long periods of time. As they weaken, you have balance and coordination problems as well. So if we can strengthen up the quads and balance it with strengthening the hamstrings, you create an overall better environment, more mechanical, a better, more mechanical environment that will help you with stability, coordination, and balance. Do you want to try a little bit more?
Yeah, I'll try some more.
We space these out. We can do as many as 2 a week for those that might be pressed for time, but it's better to do these about once every 7 to 10 days as in the muscle building mode. And the number depends on the location in the body we're trying to address and how much work there might need to be. each session's about 30 minutes. We're looking at about 4 to 6 sessions typically, and you start to see the effects as soon as 1 month after the sessions, but you really starts to kick in surprisingly about 3 months after the completion of the sessions, and the effect persists beyond that. Yeah.
Now, do me a favor.
Okay.
Say what you just said about timing to that camera.
Okay.
And yeah, if you get kind of near my feet, I think that you're in shot.
Okay. So in this particular, for this particular indication, we place the paddles on her abdomen. As you can see, she's in fantastic shape. So she's probably going to need about 4 sessions, 30 minutes each, spread out between 7 and 10 days apiece. She'll start to see the tightening and enlargement of the muscles, in this case the six-pack, in about as early as 1 month, but we'll certainly see the effects by the 3rd month mark. Those effects will persist into the 8th to 9th month after the completion of the series. And then we recommend a quarterly maintenance session of about 30 minutes just to keep her investment going. I think she's going to be happy with the results. And in addition to strengthening the muscle, it's also going to help eliminate some of the subcutaneous fat around the muscle. It's probably being used as an energy source for the 5,000 contractions that are taking place in that 30-minute period of time per session. Additionally, the device will project the beam of energy, if you will, up to 6 inches into the abdomen to help melt away some of the fat that is being used currently around the organs. We need some to protect the organs, but we don't need a lot, and actually, if allowed to accumulate, it becomes a risk factor for other medical conditions, including heart disease.